So who remembers Lerato? Our ambitious go-getter. Lerato is 30 years old, the first in her family to graduate, and is now thriving as a project manager at a major finance company. Lerato is hardworking, driven, and determined to conquer every single one of her goals. But here's the catch. Lerato has a family history of hypertension, meaning that her grandmother, aunts, and even her mother all live with high blood pressure. And lately, with mounting deadlines, long office hours, and little time to rest, she can feel the stress is definitely piling up. Could Lerato be at risk? And if so, what exactly is hypertension? High blood pressure is when a person's blood pressure stays consistently above safe thresholds. In medical terms, this means that a person has a reading of 140 over 90 or even higher, confirmed on repeated measurements. It happens when the blood pushes too forcefully against the artery walls and strains them over time. If this continues, the arteries stiffen and narrow, making it harder for blood to deliver oxygen and nutrients to the body's vital organs. The result of this is an increased risk of stroke, kidney damage, and even heart attack. And this is why hypertension is often called the silent killer. Many people don't notice any symptoms at all, and when they do, they only find out after a serious health event. Others may feel headaches, dizziness, blurred vision, or chest discomfort, but waiting for symptoms is dangerous. The only safe way to know is to check your blood pressure regularly. Now let's bring it back home. In South Africa, national surveys estimate that about half of adults, a whopping 48.2%, were living with hypertension in 2016. And the worrying part is that only 1 in 3 of those people even knew that they had it. And it's not just in South Africa. In sub-Saharan Africa, hypertension is one of the fastest rising health challenges, often striking people much younger, right in their prime working years. And this is why Lerato's story is so important. Corporate life doesn't directly cause hypertension, but it can definitely predispose someone to it. Let's have a look at Lerato's lifestyle. Lerato is under chronic occupational stress. Deadlines, the pressure to perform, and long hours with little downtime keep her stress hormones such as cortisol and adrenaline elevated. This tightens her blood vessels and raises her blood pressure. She leads a sedentary routine, spends most of her days sitting at a desk with little to no physical activity. She has an unhealthy diet of fast food and takeaways loaded with salt, fat, and processed content. These are her go-to meals. Coupled with poor sleep and her family history, all these make her even more vulnerable, adding to the risk that she already faces. Step by step, with every missed workout, every salty takeaway, every late night, every stressful day, Lerato edges closer to the tipping point. So what should Lerato, or anyone that resonates with her story, do? The good news is that hypertension is both preventable and manageable. And the first thing you can do is to understand your numbers. Visit your nearest healthcare provider to get screened for your blood pressure regularly. By understanding these numbers, you can also learn how to take your own blood pressure reading from the comfort of your own home. Stay active. Research has shown that even a 10-minute walk during your workday can make a significant difference to your heart health. Remember, exercise is not punishment, so find something you enjoy, something that energizes you, and something that you will not quickly fall out of. Prioritize a nutritious diet. For someone like Lerato, this could mean meal prepping on weekends, packing lunch for work, and cutting back on salt and processed content. Find healthy ways to manage your stress. This could mean journaling, practicing mindfulness, meditation, or simply logging off from work devices after hours. Protect your downtime at all costs. Avoid harmful habits. Limit your alcohol intake and quit smoking altogether. Both of these are major risk factors. And should you be diagnosed, it's important to follow through with your treatment. Stick to your medication and attend all your checkups. So if there's one thing you need to remember from this video, remember this: the small shifts make a difference. So take the stairs, stretch at your desk, drink water instead of the endless coffee, and step outside for fresh air between your meetings. But beyond the physical side, workplaces matter too. Psychological safety, which refers to the feeling that you can speak up, set boundaries, and take care of yourself without fear of punishment, plays a huge role in managing stress. When people feel supported and seen at their workplaces, their stress levels lower and their health outcomes improve significantly. Because while hypertension may be silent, the choices we make each day and the environments we work in can be loud enough to protect our health and our future. So make the right decision today. Know your numbers, look after yourself, and support a healthier workplace for everyone. Remember to please like, comment, and subscribe for more practical health insights from Ruta Batho Health. Thank you so much for watching.